We don't get this type of expansion only with MSE. We get this type of expansion in children. We get this type of expansion with any type of expander in adult that opens without surgery. So what you have on that slide is demonstrating not MSE type of expansion, but expansion that happens in the facial skeleton without surgery in adult or a child. So that's the expansion, that's the center of rotation of the maxilla when you do any type of skeletal sutural opening without surgery.
Mm-hmm. Mm-hmm.
So first of all, now to answer your question uh, about aesthetic concerns, um, we should not be expanding patients that don't need expansion. So the reason why we are expanding patients is because the patients have deficient midface or deficient upper jaw.
Mm-hmm.
And usually the shrinkage happens all the way from the cheekbone down to the level of the teeth.
Mm-hmm.
That type of skeletal midfacial opening is favorable for the facial aesthetics, but it
Mm-hmm.
may look very abnormal right when you open the suture before you start molding and closing the gap and start uh, finishing positioning of the teeth. So I cannot say that maxilla necessarily drops in all the patients. So that's something that we have to really study, because I don't see that all patients that it just automatically drops. But I do see a drop in the maxilla if it gets asymmetric toward the end of the expansion. That's one side, depends on what sutures are fully opening, that side will drop to in relationship to the other side. But the problem becomes with aesthetics is when the patient has pre-existing asymmetry in the upper jaw. So pre-existing asymmetry, you expand, you still open the maxilla and the face at the same sutures. So one side will be exaggerate, like more asymmetric than the other, because there is already a cant and there is already an asymmetry in the upper jaw. So you have to watch for it, and you have to explain to the patient that you may be limited how much you can expand without surgery, and maybe that MMA surgery and re-angling and addressing the cant surgically is the answer for that patient. But in general, if the maxilla is deficient and the face is proportionate, and you measure according to the proportions of the face and how much expansion need at the level of the upper jaw, the face aesthetics should improve, because you are improving the balance between the muscle attachment around the eyes in the orbital area. So they're going to be less squinting when the patient smiles, that less facial musculature engaged when they talk or they smile. So the face will look more relaxed and more balanced. So when I can show you case after case, not when the patient is expanded, but the patient when the patient is finished with moving the teeth and the bone healed, the face will look better. It
Mm-hmm.
will look worse if there is significant asymmetry pre-expansion, and if there is asymmetric expansion that happens, that definitely could be an aesthetic effect. But if it is done for deficient maxilla and you improve the proportions between the mid face and the lower jaw, you are more likely to get the diamond shape face and improve the aesthetics.